Good morning and welcome to today's episode in the Women's Health series. And today I'm talking to Lisa Nicholson, who's going to tell us a very personal account about how she had endometriosis and unfortunately had to have a total hysterectomy at age 35. Fortunately, she'd already had 2 children, so she's able to enjoy parenthood and move on with her life. But we're going to hear all about how it came about and how she went through the treatment process and what things are like now. And Lisa set up her own social media management consultancy about 18 months ago, and so she's absolutely thriving in lockdown, but juggling the demands of 2 kids at home. And what's really impressive about what she's doing is that she used to be a midwife, and she has decided to niche in women's health. So she's interested in working with doulas, independent midwives, sleep consultants, anybody that is really dealing with pregnancy and maternal issues. Is that right, Lisa?
Absolutely, and just women's health and well-being in general.
Yeah, so you can tell us a bit more about that at the end if you like, and share your links and where we can find you. But for now, if you could just start by telling us a bit about what happened with your health and how it came to light that you had endometriosis.
Okay, of course, thanks, Sally. So basically, shortly after my daughter was born, probably within the first 6 months, is when my symptoms started. And, despite at the time working, in maternity, in women's health, I knew very little about endometriosis, and I have to say it wasn't something that I considered at all to relate to the symptoms I had. There's so little knowledge out there, even now.
Sorry to interrupt, could we just explain to the viewers that who don't know, endometriosis is basically where tissue that normally lines the uterus, it's called the endometrium, grows outside the uterus. So it usually affects the ovaries, the fallopian tubes. It can grow in the pelvis or the bowel, and basically it kind of thickens and hardens and can lead to painful periods, infertility or subfertility. Not always, but sometimes it can. So sorry, back
absolutely
to you.
Yeah, no, absolutely. So yeah, it basically grows where it shouldn't be, and there's even been cases documented of the growths being seen in the lungs or even in the brain. So it can literally grow anywhere in the body. So for me it was confined to my pelvic region, and the overriding symptom for me was pain. So like you said, a lot of women suffer from very heavy periods with endometriosis, and that's often a real sign that something is wrong. And you're not just not a normal heavy period, but extreme heavy periods with a lot of pain associated as well. I had a Marina coil fitted after my daughter was born, and actually continued having no periods at all right through until I had my hysterectomy. So for me, that was a symptom that was completely missing. And that does happen with women whether they have a coil or not. So for me, I was gradually getting more and more pain in my pelvic region, and was misdiagnosed with anything from a UTI, a muscle, torn muscles, all these sorts of things, and was back and forth from the GP for probably about a year initially. And then when my daughter was about 18 months, I eventually had a scan which picked up some ovarian cysts, and they were very, very tiny. But the doctor that I saw at the time said, well, okay, but you're in a lot of pain, so it must be the ovarian cysts. So we'll do a laparoscopy and we'll have a look and we'll take them out. So I had that surgery, and they removed a few very small ovarian cysts, and said that they couldn't see anything else going on, it was all fine, they've removed them, but were pretty dismissive about how much pain I was in relative to these cysts. And it made me feel like I'd made a fuss. And, you know, I'd had both my children naturally, with minimal pain relief. I thought I had a really good pain threshold, but it really put a doubt in my mind over what I was thinking about, you know, and all this pain that I was going through. And so after I'd recovered from the laparoscopy, the pain returned, you know, within a matter of months, you know, a couple of months of that surgery. And I kind of felt at that point I couldn't go back to anyone because I was just making a fuss, and I needed to, you know, just get over it, put up with it, you know, and you know, be a bit braver, and get on with life, really. But it seemed within sort of another 6 months, it became apparent that I couldn't just carry on. The pain was too bad. It wasn't as part of a monthly cycle, so it didn't come just for a few days every month. It was near constant. I was constantly fatigued, which is another, you know, really big symptom with endometriosis. Is, you know, it causes massive fatigue, and they think that's, you know, partly a symptom of the disease, but also partly a symptom of the symptoms, if you like. You're in so much pain, you don't sleep well, and it kind of compounds a little bit. You know, there were nights when the only thing I could do to get any relief was to run, you know, pretty much as hot a bath as, you know, I could physically stand getting into, and just lying in a bath at 3 o'clock in the morning, sort of fighting sleep but fighting pain, and knowing that the minute I got out, you know, it would be back again. And we were in a fortunate enough position to be able to see a private consultant, and I was really lucky that just by chance I was referred to a gynecologist who specialised in endometriosis, and within about 5 minutes of being in his office, he said to me, I think you've got endometriosis. And it felt like a relief, actually. He said it explains all your symptoms over the years. And, you know, I said to him, I said, well, you know, I've already had a laparoscopy. And he said it is so difficult to see sometimes, and that you really need a specialist to be able to look. He said it almost certainly was there, but because they weren't looking for it, they'd gone in assuming it was ovarian cysts. They hadn't seen it. And so he arranged for me to have another laparoscopy, and found that actually the endometriosis was covering to a massive degree my pelvic region inside. So as you said, it had covered my fallopian tubes, my ovaries, my uterus, but it had also started to cover my bowel and bladder. Right. And part of...
Are they able to determine sort of how long it had been growing there for? I mean, do you think it predated did you have any issues trying to conceive or having your
No, so for me, we conceived really easily, with all my pregnancies, very easily, and so he felt it probably started after I'd had my daughter, and could well have been sort of almost a hormone trigger after having her. And part of the pain I was getting, and it was almost like it felt almost like a tearing if I moved, so it felt like my sort of around my abdomen was kind of almost ripping, is how it felt, and part of that was because my bowel and bladder and uterus was starting to adhere actually to the outer layer of the abdomen, so as I was moving, things were being pulled where they shouldn't have been. And so it was obvious from that point. It was very serious, and couldn't be left. You know, I couldn't just have walked away from it at that point. So he did what he could to remove at that point what he could, and get rid of a lot of the scar tissue, which is often the biggest problem with endometriosis, is where that scar tissue formed. So for me, it had formed between different organs and sort of stuck them together. But then
when they operate, do they do keyhole surgery, or do they have to do almost like a sort of C-section and go into?
No, so both my laparoscopies were done by keyhole. So they do it using what they call 3 ports, so 3 holes, if you like. So they always go in through your belly button. That's where the camera goes in, because it's the largest port. So my poor belly button has now gone through 4 times.
Oh.
And then they put 2 ports lower down, which they use for instruments, to actually, you know, do some treatment and do some removing of different bits.
So there's sort of minimal scarring on the outside.
Absolutely.
It's quite impressive, isn't it, how they can operate in that way?
It really is, yeah. And actually, you know, despite, like I said, having multiple of these surgeries now, you wouldn't actually know. If you didn't know it, you wouldn't know.
Yeah, you wouldn't spot it. So
No.
you were just explaining how he took as much out as he could. And when was that? That was just after a year or 2.
So that was
it?
Yeah, so she was probably by that point maybe 3, just 3.5. And that obviously then opened up a conversation as to what do we do next, and where do we want to go with this. And I suppose that's when, you know, the tough conversation started, really.
But is that because, you know, they're saying, well, we've taken out what we can, but it's going to keep growing and it's going to keep happening?
Absolutely. So yeah, all of the scarring around you know, the bowel and the bladder would have just kept returning, and he said, you know, at the moment it's not causing problems with, you know, either my bowel or my bladder, but it could. And then obviously you're into a whole other realm of conditions and problems.
And how were you feeling emotionally and mentally through this time?
I think initially, actually, when I came round from the laparoscopy and he told me what he'd found, there was an element of relief, to be honest, that actually, you know, this was a genuine condition. I hadn't been making it up. You know, there was an explanation for how awful I'd been feeling, you know, for the last few years. So there was an element of relief, definitely. But then obviously concern over, you know, well, what do we do? You know, he hasn't got rid of it. You know, it will return.
And does anybody in your family have it? Is it something that tends to be hereditary, or because I mean, I know from a Chinese medicine perspective, which is obviously you know, my background, we would say that it's caused by qi and blood stagnation. So it's literally like you know, eventually in very chronic cases, the blood can sort of stagnate to a point where it forms masses and tumours and lumps and things. And that can be from all sorts of reasons. It's not suggesting for a moment that like you did something wrong or you didn't do enough yoga or, you know, running or whatever. It's just you know, we all have sort of constitutional weaknesses in a way that and sometimes to do with our diet and our lifestyle and just general things going on that
so at the time we had no family history of endometriosis. However, my mum also had a hysterectomy very young, at a similar age that I did.
Right.
And she had that for very heavy periods. But obviously at the time it wasn't known anything about endometriosis. And so it was nothing that she ever thought. And because her symptoms were completely different to mine, so she had no pain associated with it. It was never put together. But my consultant said that actually, given her history, it's almost certain that that's actually what it was. But only through hindsight in that case.
And I mean, how great is it that we do have these the technology and the ability to search for these things now and to understand them better, even though obviously yours was missed kind of first time round. But you know, I want to sort of go back to something you said about feeling like you were making a fuss and you should just get on with it. And this is my massive bugbear and the thing that drives me in my work, because I, you know, having pain, having flooding, having clots in the blood, or terrible backache, or awful mood swings that make you want to kill somebody, they're not normal. They're not a normal part of being a woman, and we don't have to just accept it, and we shouldn't just accept it, and we need to feel like we can go to health professionals and consultants and say, I don't feel okay, there's definitely something wrong, and you need to help me find out what it is, and not just suffer and put up with it. So I'm really glad that you did find that consultant, and that I can imagine it was a real relief when he said, you know, these symptoms all tally up with this condition, and then, because then you can make a plan, can't you? And
Absolutely. I mean, I actually feel quite lucky in a way that my, you know, diagnosis actually came as quickly as it did. So even though for me it was years, the average diagnosis time for endometriosis UK at the moment, estimate, is about 7.5 years.
wow.
From first seeing your GP with a symptom to getting a definite diagnosis. And part of the reason for that is a lack of understanding within the population generally. So again, a bit like you said, women assuming that this is normal and this is just something I have to put up with because I'm a woman. Yeah. But also that it is a very difficult condition to diagnose. So no blood tests, no scans, no, you know, internal examination, nothing can diagnose it except someone spotting it on a laparoscopy. So you have to have surgery in order to get that diagnosis. And so you need a consultant that recognises the symptoms, considers endometriosis a possibility, and then schedules the surgery as a diagnostic tool. So, you know, like I said, actually for me, you know, although it was that length of time and it was years, you know, I'm so much luckier than a lot of other women.
Yeah, but I mean, even in itself, that's a big deal, isn't it? For somebody to say, I mean, I hate going to hospital, and thankfully there's been very few occasions I've had to in my life, but if somebody said to me, well, I suppose, I mean, if you are going around on a daily basis, like you described, feeling this tearing pain, having not sleeping properly, like that is completely debilitating on so many levels. And so probably you felt like, I just need to find out what is happening, and the surgery maybe didn't feel like something to be scared of or feared, just like, let's just do it so that we can rule it out. Or
I think that's it. At that point it felt like, you know, an obvious thing to try. You know, although, you know, it's a general anesthetic, it's, you know, it's not a major operation, but it, you know, it's not without risk. It felt like something I absolutely had to do to try and get some answers.
Yeah. And so for the people watching, the thing that happens when you have a hysterectomy is, I mean, sometimes they take bits of the womb or the ovaries or whatever. Sometimes they take all of it, which is what's happened to you, isn't it?
It is, yeah.
So when you have that done, it throws you into early menopause. So what was that like for you, and how have you managed that?
So I mean, obviously the first thing that we had to consider was, obviously this is not reversible, and so my consultant was very good at giving us a lot of time to consider it, and I actually had 6 months of hormone injections that put me into a temporary menopause. And the idea behind that was to see whether if we could basically suppress all of the estrogen in my body, like would happen if they did the hysterectomy, would it improve things? Would it improve my symptoms? And actually it very quickly did. So within the first month of those injections, I noticed a remarkable improvement in my symptoms. And actually it was done over a summer, and I can still remember feeling that summer and through that sort of summer holiday and thinking, wow, you know, I don't feel so tired, I'm not in pain, I can do so much more with the children. And so for me it was a really good opportunity to almost try it out, if you like. But what it obviously did mean was that was the end of our having an extended family. So we my husband was certainly fine with that. And I think I realized actually it was absolutely the right thing for us as a family to do, and that if things continued as they were and I got worse and worse and needed more surgery, actually that in itself was going to have an impact on our 2 young children in a negative way. And so for us it was absolutely the right thing to do, and obviously this is an horrendous situation to be in if you either haven't started or you haven't finished having your family. And so I'm really aware of that, and how lucky we are that we were in that position where it was a relatively easy decision to make. I won't say it wasn't without a few tears along the way. Just having that choice taken, it suddenly wasn't my choice anymore, I felt. And I can remember the night before my hysterectomy, having a really clear dream of having twins and being so happy about it, which in reality I think I'd have freaked out. But I can remember everyone around me, my husband and my family, and everyone was like, this is amazing, this is the best thing ever. And even in my head thinking, I'm not sure that's how everyone would react if I said I was having twins. I think it was a subconscious, last minute, this is never going to happen. But I think we were prepared for it, and it was obviously a major operation. It was again done by keyhole, but obviously internally massive amounts of scarring and trauma. So like you said, I had a total hysterectomy. So I had my uterus, my fallopian tubes, my ovaries, and my cervix, not my cervix, sorry, and my cervix all removed. Because the risk is that if even one tiny bit of endometriosis is left on any of those, it can regrow. And so you need a really skilled surgeon that can not only remove all of the organs, but can then make sure that there is nothing left. So they needed to then do a really good cleanup on my bowel and bladder and on the abdominal wall, and all of those areas, to make sure that they minimized the risk of it coming back. But it was made very clear to me from day one that this is a treatment option, it's not a cure. There is no cure for endometriosis. So there was no absolute guarantee. And I guess that is hard, that actually you could go through all of this and then it could come back.
Yeah, well, because I was wondering about that if it can also grow in other parts of the body, then you can't have your brain taken out or your
absolutely
whatever. So I mean that must be like very severe cases that are extremely unfortunate to have it get to that kind of stage. And so subsequently, did you make a full and easy recovery, and is your life transformed? Or
so the initial recovery was really hard, and it took me a lot longer than I expected. And I think in part because it's done keyhole, what you can see on the outside heals really quickly, and so within a few weeks it looks like nothing's ever been done. And then sort of psychologically, you look at your body and you think, oh, I'm healed, but actually what's going on inside took months to heal. And I was really tired, and obviously I still had 2 fairly young children, and I wanted, I was young, I wanted to get back on with life, but I would certainly know if I'd overdone it, and needed to kind of rein it back in a bit. So the first few months were really tough, and yeah, they really, for someone that's used to just getting on with things, to have to admit you needed help and asking people to help, didn't come naturally. But luckily, I had really good family support, so that was great. And then after that, really it just went from strength to strength. After the initial recovery period, I found that I was much less tired. I had a lot more energy. Touch wood, I haven't had any pain since, which is great, and I am aware that this isn't a guarantee, but certainly so far so good. And yeah, just feeling really so much better than I had been for those years before. And obviously it has sent me into early menopause. And part of the problem with endometriosis is it feeds off of estrogen. And so what would if you had a hysterectomy for, you know, any other reason, the first thing they would do is to start you on an appropriate level of hormone replacement therapy, if that's what you chose to do. But it would be at least an option. Whereas for me, the most they could do was put me on an absolute minimal dosage, which I chose to do. And so I have patches that I wear on the top of my leg, but it's a very, very minimal dose. So it does keep most of the symptoms at bay. I would say I still suffer with hot flushes, on and off, not all the time. But on the whole, I think I've, you know, coped with it quite well. I haven't wanted to, you know, murder my husband or, you know, any of those other things that, you know, I'm well aware, you know, I think I got away with it a bit lightly, and maybe things will change. Obviously I've got years until or potentially years, I'm not that young, you know, until naturally I would have gone through this and finished. And so I think I just kind of have to take it, you know, month by month, year by year, and just see how I'm coping, really.
Yeah, and I mean, actually, people like you are kind of my ideal audience, really, because I like to approach everything from a very natural perspective. So, you know, I definitely think that, of course, surgery sometimes is a complete necessity, so is sometimes taking medications, but I think it's great when people can do all the natural stuff, or just alongside, you know, because it always helps whatever stage of life we're at. And like you said, I mean, you're only 39 now, so the average age of menopause in the UK is 51, so you know, you've got a long time
to go. Yeah, absolutely.
But also something that I've learned recently is that you know, HRT's come a long way since the days when you know, there were all those scare stories about it causing cancer and stuff. And I think that again, every woman needs to have the support and guidance and information to make the best decision for her. And as long as you can make an informed decision about what's the right thing, then that's great, isn't it? And
it really is, yeah. And I felt I was really lucky that I had a consultant that was very open and would always, at every stage, would present me with what the options were, what were the pros and cons of each option, would give me as much time as I needed to make those decisions. You know, I didn't feel rushed at any point. You know, I was able to ask questions, and so I felt I made a really informed decision that was right for me and right for our family. And it certainly wouldn't be the same decision that, you know, someone else would necessarily make, but it's about having that information to make that informed choice, definitely.
Yeah, I mean, I think, like you said, it's so lucky that you'd already had your children and you could come to terms with the fact that you wouldn't be able to have any more. And I understand, I think every woman would understand that feeling of having a choice taken away from you, because you know, I'm 45 now, and so I'm not going to have any more children of my own, but I always thought that I would have more than one child, which I have. And but it's just, I mean, it's not something, I don't cry myself to sleep about it, but I think that you know, there sometimes there's just this little feeling of like, oh, that door's shut now, really, you know. It just and it's a hard thing to deal with, even if you wouldn't dream of having more children. It's just, like you say, it's something that your body, I don't know, it's kind of tied up with being a woman, isn't it? And being a mom.
It is. And I think, you know, I've always been so maternal, and, you know, obviously, you know, I became a midwife, you know, it was always on, you know, I always thought I would have lots of children, and actually our son, our firstborn, sort of scuppered that a little bit by being a dreadful sleeper. So I think quite early on I was like, okay, I'm not having too many, but it was that choice, and I think it went against my just natural maternal instinct. And so I think in that first year or two afterwards, especially, you know, the minute I heard that someone was pregnant or something, you know, it would upset me, even though perhaps we never would have had, you know, and I'm sure actually we probably never would have had another child. But but it's that kind of, you know, the heart ruling the head. You know, logically I knew in my head that we wouldn't have had another one anyway, but my heart saying, well, I didn't get that choice.
Yeah,
but like I said, I do feel lucky, you know, there's others that never got that chance in the first place.
So what would your advice be to anybody that suspects that they might have it, or that knows that they've got it, and what would you recommend that they do?
So I think if you've got any suspicion that you've got it but you don't have a diagnosis, I would say really be strong in, you know, pushing for, you know, further investigations. You know, don't be fobbed off. You know, even if you get to the point of, you know, seeing a specialist and you still don't think, you know, that answer is right, and perhaps you haven't, you know, gone down the laparoscopy route yet, you know, ask for a second opinion. It's absolutely your right to ask for a second opinion. And you've got to be really strong, and it's hard because you're probably at a point where you're absolutely exhausted, you're feeling physically awful, you know, so it's really hard at that point to be strong, and to really push for something. But I would say just really persevere, you know, in trying to get an answer if you can. And to someone that's been diagnosed, I think, a bit like I sort of said earlier, it's about getting all the information related to, you know, your particular circumstance. So knowing exactly, you know, what sort of, you know, condition, you know, it is, because there's, you know, there's a real spectrum of, you know, a tiny little bit of endometriosis up to massive amounts of endometriosis, but also depending on where it is. So some women can have masses in terms of volume, but it's causing very little symptoms, and other people can have a very little amount, but depending on where it is and how much of that is sort of scar tissue, it can be causing massive problems. So it's getting all that information, but also then learning what your options are, and I would say take your time. You know, chances are it's been years getting to that point, and so don't feel pressured into making a decision, certainly not there and then. You know, if you've managed to get a consultant appointment, don't feel like I have to make the decision before I leave this room. You know, ask to go away and think about it, and to have a follow-up appointment, and ideally a chance to perhaps email with questions or something in the meantime if you've got them. And, you know, especially if you're thinking of something, you know, as drastic as a hysterectomy, which won't be right for everyone, you know, you really need to take that time and be as happy as you can be with that decision. And I would hope that, you know, the medical staff would support taking that time, and talk to your family, your friends. You know, ultimately it's got to be your decision, but it definitely does help to get all that information and then talk it through as well.
Yeah, which I think is just great advice in life, isn't it?
Absolutely, yeah.
To make a big decision, just get all the info and then take it from there. And so if somebody did not want to go down the hysterectomy route, would they possibly treat them like they did when they were trialing you on the, you know, putting you in menopause? Is that how they would deal with it to alleviate the symptoms?
So that would be one option. So and certainly for me that definitely helped, and that gave me a few months of being pain free and you know, relieved from the symptoms. But obviously that is, you know, that is injecting yourself with hormones, you know, on a monthly basis. You know, I was you know, going in to be injected every month to have that done. So that wouldn't be perhaps, you know, something everyone would like to do, but it is obviously it's a non-permanent treatment option. I mean, the other option that my consultant gave me at that point was if we wanted to try to have another baby, or if I wasn't ready to go down the hysterectomy route, then he would perform a second laparoscopy and basically try to remove as much of the scar tissue and the damage to my ovaries and fallopian tubes, to allow us to try and conceive. And I know that this is something that certainly for women that either haven't started their family or aren't finished, consultants will try to do what they can to improve the fertility and the chances of conceiving, and you know, obviously carrying a baby. So I was given that as an option, but obviously there's no guarantees, and for us that wasn't the right decision, but it is another option. But you know, for me, judging by how quickly things were progressing, you know, I probably would have ended up with a laparoscopy every year, just to control the worst of the symptoms. And then obviously you have to factor in the recovery time every time after that, you know, a general anaesthetic every time.
Yeah, absolutely.
There's lots to consider.
Yeah, and I think again, you know, that's not a decision to be taken lightly, and in some ways having one sort of big operation and just getting it all dealt with. I know obviously they're saying, well, it could still come back, and it, you know, it may not be the final thing, but that sounds, certainly in your case, like that was absolutely the right thing to do, rather than being in pain most of the time and then having these sort of clean up ops a few times a year.
Absolutely, yeah.
Your kids are still young and you're still young, and it's not really a way to live your life, is it? Just sort of going from one operation to the next and just managing in between. But
absolutely, and that's exactly the decision we came to, was, you know, for my quality of life, for our family's life, for us, that was the right decision.
Yeah, and I think you made a really important, relevant point as well about you know, sort of just taking time to really think everything through and not feeling pressured into a decision, because I know that well, it is known, isn't it, that, and you'll know this probably from your sort of health background, that I think often when people get a diagnosis of something, they often recommend to take somebody with you to the consultation, because you just literally can't hear anything that the doctor's saying, or you can't remember afterwards. And especially if you're in pain, you know, if you haven't slept, your concentration's not good, your memory's not the best. It's just, and fear gets in the way, and you'll be in that, you know, have a lot of cortisol and adrenaline going around. And so everybody needs to give themselves the best chance to just process everything in a very calm way in their own time, when they can properly sort of absorb what's being said to them and what the options are ahead.
Definitely. And we were given quite a lot of sort of written information as well to bring home, so that we could, you know, read it through in our own time, and that helped as well.
Yeah. Yeah, well, it's been fascinating to hear about, I don't mean to make that sound like you're some sort of
no, that's fine.
but you know, I think it's really interesting, and that's partly why I'm doing this series, because I want to bring these kind of issues to light, because, you know, most people don't talk about it, and particularly where things are connected to fertility, it's a very personal, touchy subject, and lots of people keep it very private. And yeah, you don't want, I mean, like you said, you felt like you were making a fuss, so as if you weren't allowed to kind of express the pain and stuff that you were going through, and that you had to kind of keep it to yourself. And that's not okay. It's not all right that, you know, we are made to feel as if we've just got to sort of keep everything inside and wait until it gets absolutely desperate and we can't manage before it gets resolved. So I'm sure that there will be people watching who will really benefit from what you've shared. And so where can people find you if they would like to ask you more? I mean, would you be happy for anybody to contact you if something's triggered?
Absolutely. Yeah, no, if people have got questions, I'm more than happy to talk about it. And like I said to you before the call, you know, it is really personal, but, you know, I'm quite open about talking about it with people. So absolutely, if they want to. And I'm mostly on social media. I'm mostly on Instagram, but I'll also give you my email address. So maybe if you just add that into the video, people can get in touch. Absolutely.
Yeah. Okay. So just tell us now what it is, so that if anybody's watching, they can write.
So on Instagram, I'm at Bluebell Social Media, and my email address is lisa@bluebellsocialmedia.com.
So that's easy. So
nice and easy.
Perfect. Well, thanks so much for taking time to talk to me today. And
my pleasure.
Yes, and for everybody else, from my perspective, as you know, I deal with balancing hormones. I work with fertility and menopause, so covered everything today. And please feel free to get in touch if you'd like to know more about anything we've talked about. And thanks, Lisa, and look forward to seeing you again soon.